Good afternoon, and welcome to our annual symposium, The Genetics of Kidney Disease and Kidney Regeneration. I am David Wyman, president of the Rogosin Institute. All of us at Rogosin take great pride in being at the forefront of kidney care, and today look forward to a day of collaborative learning, insightful discussions, and practical takeaways to advance the care of patients. Today, we will bring into focus an increasing understanding of kidney genetics and how it has illuminated the underlying causes of kidney damage. New discoveries are driving development of new therapeutic approaches to regenerate kidney tissue and to slow the progression of CKD. First, I would like to thank today's speakers. Glenda Roberts, Director of Communications and Patient Engagement, the Kidney Precision Medicine Project at Mount Sinai Medicine. Leif Oxberg, Scientific Director and VP for Basic and Clinical Research at the Rogosin Institute. Jordan Nestor, Columbia University Vagelos College of Physicians and Surgeons. Barry Friedman, Wake Forest University School of Medicine, and moderated by Jeff Silberzweig, Chief Medical Officer of the Rogosin Institute and Associate Professor of Medicine at Weill Cornell Medicine. We hope you will find today's program both engaging and informative to the important work you are doing for caring for patients with kidney disease. As we all know, chronic kidney disease and end-stage renal disease continue to present significant healthcare challenges nationally, and dialysis and transplantation remain primary treatment options. For those of you that do not know much about the Rogosin Institute, today Rogosin has more than 500 team members and provide care for approximately 15,000 patients across 10 dialysis and 3 clinical locations in the greater New York City region. Rogosin provides care for a broad spectrum of kidney disorders, including recently being named a Center of Excellence for Polycystic Kidney Disease by the Polycystic Kidney Foundation, host kidney transplant care, as well as the largest laboratory for immunogenetics and transplantation in the New York City region. Rogosin is a national leader and one of the largest home dialysis providers in New York City, meeting the needs of our evolving healthcare landscape. Rogosin is a leading center for clinical research where providers are helping to define new treatments and therapies as well as basic research. We are home to the Kidney Regeneration Medicine Lab, headed by Leif Oxberg, who will be speaking later today. Rogosin takes great pride in caring for patients with unique and unmatched approach to patient-centered care that involves not just clinical excellence, but innovative and technologically advanced environments. With that, it is my great pleasure to introduce Dr. Jeff Silberzweig, CMO of the Rogosin Institute. Again, thank you for joining us this afternoon. Jeff?
Good afternoon. Thank you, David. I'd like to add my welcome and my thanks to all of our panelists for joining us. This promises to be a very exciting program, and we're very much looking forward to having some great discussion and learning quite a bit today. I'd like to begin by reviewing our symposium goals. And the goals of today's symposium are to highlight the critical role of genetics in the development and progression of chronic kidney disease, to explore the patient perspective on the importance of understanding individual genetic risk factors for kidney disease, to examine the molecular and genetics pathways involved in kidney regeneration, to gain an understanding of how genomic data and point-of-care genetics can be integrated into clinical nephrology practice, to emphasize the utility of genetic testing in diagnosing and managing hereditary kidney disorders, to evaluate the role of genetic information in assessing kidney disease risk among family members in future generations, to investigate the impact of APOL1 gene variants as a major determinant in unexplained CKD, particularly in high-risk populations, and to review current and emerging treatment approaches targeting APOL1-mediated kidney disease. Our 2025 symposium presenters have confirmed their status with regard to conflicts of interest related to their participation in today's program, and will highlight those conflicts, if there are any, as they begin their talks. Our program today is accredited for continuing education through the Medical Society of the State of New York and joint providership with the New York Presbyterian Hospital of Queens and the Rogosin Institute. The New York Presbyterian Hospital of Queens is accredited by the Medical Society of the State of New York to provide continuing medical education for physicians. This activity has been designated as a live activity for a maximum of 3 AMA PRA Category 1 credits. Physicians should only claim the credit commensurate with the extent of their participation. This activity has also been accredited for contact hours, for 3 contact hours by the board, by Bonant, and for all nurses and technicians.